Hello everyone, welcome to Doctor Story. I'm Anchal Arora, Content Head at MyCare. Did you know there are rejuvenation clinics? What if I tell you there are eye-face rejuvenation clinics? And what would be better if I tell you there's this virtual eye-face rejuvenation clinic? Moreover, it's India's first virtual eye-face rejuvenation clinic. Today, we are privileged to be in conversation with Dr. Shubhra Goel, co-founder and chief surgeon at Clinica Fai, India's first virtual eye-face rejuvenation clinic. Dr. Shubhra Goel is amongst the youngest Indian oculoplasty surgeon to win the prestigious American Academy Achievement Award. Lately, she has also been recognized as one of the top 20 women surgeons in India by Women Entrepreneur India magazine. Dr. Goel, a warm welcome to Doctor Story, and I hope you had a fantastic start today.
Oh, yes. Thank you for having me here. And I hope you had a fantastic start today. So let's get going. Thank you for having me.
Most welcome, Doctor. So as your profession is all about aesthetics, what's your philosophy of beauty?
A very wonderful question, because I feel beauty per se is pretty misunderstood and misquoted, according to me. So for me, beauty, if you look at in a very subjective manner, it's nothing but what you perceive, right? It may be a form, it may be, your status, it could be your money, it could be anything which you owe can be beauty, right? And if you look at scientifically, actually we have centers in our brain. So we have a vision center and we have a pleasure center in our brain. So when we see something beautiful, the pleasure center gets activated and it kind of tells us that this is desirable, right? So very ironically, something which is nice is perceived as beauty by our pleasure center. So something which is beautiful gives us pleasure, right? Now, to give you this context of things, this is what the beauty actually means. But to me, beauty means loving yourself. Okay. And you asked me, my specialty is all about aesthetics. Yes, well, it is about aesthetics, but I would put it in another way. It's not more of aesthetics. It's about corrective measures, how you correct what you have been having, whether it is blemishes, whether it is structural damage, whether it is an aging process, whether it's birth defects, whatever. And something which the person himself or herself is not very happy about. So it boils down to, for me, the beauty is all about loving yourself. So if you start loving yourself, that's beauty for me. And if my specialty and my work can give that to the individual, I think that's what defines beauty for me in my specialty.
Amazing. Absolutely. So as I mentioned, Dr. Goel is an oculoplasty surgeon. With oculoplasty, we mean eye and face corrective treatments. So doctor, when we say eye face corrective treatments, what are the treatments all about?
Yeah, so I'm glad you asked me this question, because I don't think a lot of common people know about or understand what we actually do, because it sounds very complicated, though it's not very complicated, number one. And number two, our specialty is not very well marketed in the industry, because it's kind of compressed between a lot of other specialties, right? So it gets compressed from plastic surgery, dermatology, ENT, and all these things. So I'm really glad you asked me this question. So I just kind of break it down for everybody who's listening to us. Oculo means eye, plasty means plasty, okay? And we kind of expand it to make it simple and say eye and face plastic or corrective, procedures or surgeries or treatments and whatever. So what we mean here is anything which starts from your hairline to your chin, from your ear to ear, is your face, right? Anything around your eye. So I'm not talking about things which are inside the eye. It's all around the eye, which will be your brows, your eyelids, your lashes, your bony socket where your eye is sitting, your lacrimal or the draining or the tear passage. This all encompasses the area which we treat. So eye and face corrective measures, meaning, let's say, for example, I want to correct something on your eyebrow, something on your eyelids, something under your eyelids. So we focus more around the eyes is our primary area of, specialty or expertise. And then we expand to the face because this part of the face is connected to upper eyes. This part of the face is connected to the lower eyes. So it kind of becomes one unit. So that's what we treat. And it consists of the corrective treatments as well as the vanity treatments. So corrective treatment is something which needs a structural repair. Vanity treatment is something where, for example, if I just want to raise my brow just because I don't like it, right? So I just want to raise it because I feel it has come down and becomes like a vanity treatment, right? So there's no structural damage, but I want to look better or I want to change the way I want to look is a vanity treatment. So this is in a nutshell what it is all about.
Great. Thank you for sharing that, doctor. So what are the distinguishing factors between a plastic surgeon and you as an oculoplastic surgeon?
I know. As I said, there are, fortunately or unfortunately, there are some thin lines which can overlap between specialities because, at the end of it, the medical field is all about one unit, which is her body. So we can't really segregate it. But yes, there is a very, very specific demarcation or differentiation between what a plastic surgeon does and what an oculoplastic surgeon does. See, when you call a plastic surgeons are general plastic surgeons or body plastic surgeons. I'm just putting it very simple words for a common man to understand.
Right.
So what it means is that they would do everything which is related to your body. Okay. There are few plastic surgeons who also work on your face and around the eyes, but they are not the best of the experts to work around the eyes per se. Okay. Right. When you say oculoplasty, our whole training of 3 to 5 years is nothing but around the eyes. So we are really niche and specialized into areas around the eyes. So our basic degree is ophthalmology. So we do ophthalmology and then we do a super specialty into oculoplasty. And then if we want, we can go into facial cosmetic or facial plastic.
Right.
Like it's up to you to go and get trained for that. So what happens is our whole training is focused around the areas around the eyes, and we have been an ophthalmologist to begin with. So it's a very intricate area you are dealing with. So the way we would treat the the conditions around the eyes or even structures closer to eyes would be very different from how the plastic surgeons would do, if at all they're doing.
Right.
So that's the basic difference. So let's say I cannot do a breast implant. I'm not trained to do a breast implant, or I'm not trained to do an amputation, for example. I'm not trained to do a fracture repair of not fracture repair, but let's say there is a burn patient and there's full body burns, and plastic surgeons are the right people to go to. Tummy tucks, if you look at vanity procedures. But when it comes to everything very, very intricate, very, very delicate, very, very specific around the eyes, on the face, it's where the oculoplastic surgeons come into picture.
So as you said about the different conditions, what are these conditions that are treatable under oculoplasty?
Okay, so to make it very simple, I'm going to divide it into the areas of face. And then we can look at each area, and I'll just quickly cover it because there are a lot of things which we do under oculoplasty, but I'll give you an overview. So if you look at the forehead, that is your hairline to this area, we treat anything which happens in this area, which can be scars, which can be reconstructions, which can be tumor removals, even if somebody has cancer or something. Then we do wrinkle repairs. We can lift the forehead up. We can lift the brows up. We can fill the brows up. We can play around with this area in terms of injectables, in terms of, surgical methods. Then we come to the upper eyelids, right? So in the upper eyelids, if your skin is extra, is there a fat which is extra, that is like your cosmetic procedure. Or if your eyelids have come down, that is called the droopy eyelids. Or if you have an extra hooding of skin, which is called the baggy eyelids. Or if your lid is not in position, it's kind of turning out or in turning, that is another thing. There can be a scar, there can be trauma, there can be injury, there can be an absent eyelid, there can be an absent lash, there could be infections of the lashes, there could be dandruff on your lashes, which is treatable. There could be the tear gland issues. So we come to the tear passage now, which is your water passage. So if it gets blocked, or if you have tearing, that is corrected by us. I mean, examined and corrected. If you come to the lower eyelids and the cheek area, again, so it's infections, cancers, diseases like, any diseases which is affecting that area. You can have injuries, and you have cosmetic procedures. So in each area, these are the broad categories. So in the lower eyelids, again, if the lid is not positioned, it's in turning, out turning, any lash problem, dark circles, eye bags, okay, fractures around the eyes. If you have fracture of this bone, that bone, so we deal with that. Thyroid eye disease, okay. In thyroid eye disease, you must have seen a lot of people who have thyroid, their eyes are popping out and they look very surprised and, with big eyes. That comes under our specialty. Then if we may have seen people who lose their eye or have lost their eyes because of probably a disease or a cancer or an injury, then we kind of give them artificial eyes, which are ocularist friends, they make it, and we make it look very similar, right? And then last but not the least is your skincare, because without the skincare, nothing is complete on the face. And when I say skincare, as an oculoplastic surgeon, especially me, because I am into skincare, I'm not competing with any dermatologist because their knowledge is pretty advanced and, at a different level. Like, we are trained into specific type of skincare, which we feel works on our skin and we give it to patients, but it kind of works in a symbiosis. And then there are other treatments like Botox fillers, radio frequency skin tightenings and everything. So it's a combination of surgical and non-surgical methods. Both the methods are directed towards correction, enhancement, and a combination of these two. So you are either correcting the blemish which is there, which could be because of anything, you're enhancing the feature, or you're combining both the things. So this is basically, in a nutshell, what oculoplasty means.
So we could say the procedures that are treating such conditions are either surgical or non-surgical, two broad categories. So could we just explain some of the non-surgical methods, which a layman could understand? Because when we think of a surgery, that fear comes to our mind, that what will happen, how would it go? So how could we simplify it? How is the surgery or the non-surgical methods?
See, I agree that the patient or the client would, even if somebody asked me to undergo a surgery, I'll get scared. But the thing is, that's the whole idea of coming to a specialist. That's the whole idea of coming to an expert who has done nothing but worked around your eyes and knows exactly what to do. So I think the first step is, if you're in the right expertise hands, in the right specialist hand, that fear factor already goes down. But yes, I understand that mentality. Now, there are very specific indications for surgical and non-surgical. So we cannot do everything with non-surgical methods. Non-surgical methods have their limitations, and we can only advise it to people who really need it, because each case, each condition would be different, and we have to custom make the treatments for everybody, right? So non-surgical treatments, what I practice and what other oculoplasty surgeons are also practicing in India, are mainly Botox fillers. Okay, when I say Botox and fillers, these are injectables, these are cosmetic injections which are given. But mind you, they're not only for cosmetic treatment. We do, at least I do, or I know a lot of other oculoplastic people who do it for non-cosmetic reasons also. I'll give you a small example. For example, somebody's eye is not closing because of the facial paralysis, right?
Okay.
So in olden days, we used to stitch the eye in the corner. Okay. So nowadays, we actually fill it up, the upper lid, so that it becomes heavy, and then we can close it. So that is a use of a filler, which is otherwise a cosmetic product, which we use for cosmetic enhancements, but can also be used for corrective treatments, right? So this is one of the major, or the top list, non-surgical. Then the other non-surgical is, of course, skincare, because with skin, you can take care of a lot of blemishes, dark circles, and so on. Then I am very, very lucky and honored to have a machine called Plexer, or a plasma therapy, which is one of its kind machine in India. And, I'm the first buyer in India and also key opinion leader. And that is where we do the minimally invasive, non-surgical OPD, outpatient based treatments for small things like, there is xanthelisma where a yellow deposit happened around the eyes here. Some people will have moles on the face. Some people will have warts. Some can have, lumps and bumps around the eyelids. Some people just have extra skin. So we can actually remove that skin with this plasma pen without taking the patient on table. Wow. So this is another therapy which we do. And in addition to that, there are, some radio frequency techniques which we do. I don't want to venture and tell you a lot about technology driven treatments because then we are going into a different radar altogether. But yes, there are machines which can be used for a non surgical facelifts and so on and so forth. But we are not talking about specific cosmetic treatments today. We're talking about in general what we can do. This is a nutshell which we can do non-surgically. And yes, not to forget medical treatment. So we do give a lot of medicines for a lot of diseases. For example, I'll give you an example. If you have a computer vision syndrome, right? So you've been working on systems, your screen time is more than 18 hours a day. And you say, doc, I'm looking very tired. I've got dark circles and I feel so heavy on my lids. I feel I should rub my eyes. Every time I get up, I feel dizzy and I'm just not feeling okay. So these are very common things which a computer vision syndrome can cause. And these are easily treatable, no surgery, only medical treatment and some lifestyle changes. Right. So like any other specialty, even in oculoplastics, it's not only about surgery. Yes, surgery does form a major part of it because at the end of it, there is a structural damage or a structural change which needs to be corrected, right? Now, whether a surgical method would fit into it or a non-surgical, and are you the right candidate for it, has to be decided by the expertise.
Absolutely. So if we are talking about these procedures, are these safe and do they actually have some long-term side effects to it?
See, I don't agree or don't like the term about side effects. Okay. Let me rephrase the question. Are these procedures safe? Absolutely safe if you are in the right expertise hands, because the person has to know the subject, right? Absolutely. So I think also it's a duty of a physician and also the patient to do a thorough search, and also of a physician to be very honest about what results can be given to the patient, what are the problems which can be encountered. And most of the people or most of the surgeons, not only in my specialty, otherwise, we all discuss the risks and benefit ratio with the patient with any treatment is concerned. But in general, procedures are safe. Now, if there is a risk factor, that would be discussed with the patient, not because the procedure is bad, but because the way the disease processes or the condition is, not because the procedure is bad. Okay. So there is a difference between, I'll give you an example again. A lot of people say, now I'll give you a very simple example which people would relate to. So a lot of people say, oh my God, Botox. No, this is not for me. Oh, I would look artificial. I look like plastic. And, is it safe? Can I take it back? What if I don't do it again? Will I look abnormal? See, where are these questions coming from? These questions are coming from some of the exaggerated information, I would say, on internet, right?
Right.
So Botox per se is not bad. The drug is not bad. It's the way it is given, the way it has been taken, right? So there are sometimes patients who have unrealistic expectations and say, I want so and so thing, and physician has nothing but to do it. But if suppose or the physician has not done in the right manner, both the things are possible, right? Then we start blaming the drug, but actually it's not the drug, it's the way it has been done. So to answer your question, they are safe. There are no side effects. There are always sequelae of procedures. So I don't agree with the word side effect, but sequelae. So the sequelae happens, say, for example, if I'm doing a procedure, now if you fall down, you are going to have pain, redness, swelling, black and blue on your skin. Is it a side effect of falling or it's a sequelae of a falling?
Right.
It's a sequelae of falling, right? Sure. Exactly. So if you do anything, if you touch any part of your body, whether it's with knife, with a laser, or with a non-surgical method, there would be certain sequelae which are explained to the patient. So I personally feel all the patients out there don't have to feel scared. Obviously, you have an open discussion with your physician, treating doctor, treating surgeon. And once you've understood it and you have a real reality check is when one should proceed further for the procedures.
Lastly, there's this common belief that such treatment costs exorbitant charges. So how true is that?
Okay, what is exorbitant is my question to the thought process which comes into picture. First of all, they are not exorbitantly expensive. They are not, right? You are not looking at a procedure which is as expensive as a neurosurgery or a open heart surgery, and you're not looking at a procedure which is as cheap as I don't know how to relate it to, not even parlors. Parlors are also very expensive nowadays.
True.
So I'm just giving you a two-dimension, to the two extremes of the radar, that they are not as expensive as a major surgery and they're not as cheap as a very, very minor procedure. They fall into category somewhere in between. And based on which city you are, which hospital you are, which expertise, how many years of experience that person has, the charges may vary from place to place. So, for example, a Mumbai charge will not be same in Hyderabad. Hyderabad charge will not be same in Delhi. So that variation happens, but definitely not exorbitant. And I always tell my patients and clients that if you can stand in line to buy iPhone 5, 6, 7, whatever, I don't understand those iPhone series, and you can spend that amount of money there without thinking twice, it's definitely not that expensive when you come to do a procedure. Actually going to make you look beautiful or feel beautiful about yourself. So it's a I think a misconception that these procedures are expensive, and I do understand where it comes from, because a lot of it is attached to vanity. Again, a lot of it is attached to the rich and famous, the page threes and the socialites, and it feels like, oh, this is not my cup of tea. Believe me, Anchal, in my practice, most of my patients are common people, right? Most of them are common people, and it's not like that. So I hope what I'm saying echoes and goes through, and people understand that these procedures are not expensive, and whatever they're paying for is for the betterment of themselves in whatever form or processes they have presented themselves to the physician.
Yeah, definitely, it's far more worthy than the iPhone. Then you have that.
Of course.
Well, thank you so much, Doctor, for joining in and for this insightful information. I hope this the myths are busted. People are more open with their doctors, are more searching for such things, because most of the people don't actually know such clinics exist, and if they know, they seem to be not affordable for them. So I hope this video helps to all of them, and thank you so much for taking out time for us.
Thank you, Anchal. And just as a closing remark, I just want to say that at Clinica Fai, our philosophy is not selling. Our philosophy is to make you feel comfortable, understand, have a reality check, and titrate the cost and treatment according to the background you're coming from. Because at the end of it, our aim is to keep you happy, make you happy, and give you the best treatment. The money is secondary, it comes later, right?
True.
So I just wanted to reiterate, and I think most of the doctors in the industry are like that. So I just wanted to say that, because unfortunately today the medical profession is looked upon as being very commercial. So I hope that is kind of clarified over here.
And I hope likewise. Thank you so much.
Thank
you.
Have
a great rest of the evening, Doctor.
You too. Thank you so much for having me.
And for all of you watching us online, on which of the topic do you want us to discuss with leading doctors? We would love to hear that from you in the comment section below. For now, thank you so much for watching. God bless, and we will see in the next insightful session of Doctor Story.